Hello friends, welcome to my channel. Today we are going to discuss different types of introduction in OET writing. Well, before starting, I will discuss some of the important tips or points with you. Well, mainly introduction paragraph is also called purpose paragraph. So first we start with the case note and then ask yourself the question like who are you, who is the patient, who are you writing to, and why are you writing the letter. So these points must be kept in mind. Okay. So first I will discuss with the referral letter like this. Referral letter. I am writing to refer Miss X, who is suspected to have space occupied lesion. She requires urgent assessment and treatment at your facility. Second example, I am writing to refer Miss X, who has been diagnosed with acute renal failure. She requires further evaluation and management. Then next is, I am writing this letter to refer Mr. X, who underwent insertion of continuous ambulatory peritoneal dialysis for chronic renal failure. He requires ongoing care and support at your service. So well, as I have already discussed with you that what are the points we have to keep in mind while writing the purpose. First is who are you? Like I say, I am. Then who is the patient? So Miss X. Who are you writing to and why are you writing? So why this purpose paragraph show why is here? She requires urgent assessment and treatment at your facility. So with these all the points, our purpose paragraph is completed. Then next is update letter. I am writing this letter to update you regarding Mr. Lionel Ramamurthy, who has been diagnosed with stroke. He requires monitoring and continuous care following his discharge tomorrow. Next, second example is for update letter is I am writing to update you on the current health status of Miss X, who has been diagnosed with multiple colic and moderate bilateral hydronephrosis. She requires ongoing care and monitoring. Next, third letter is home visit. It can be a home visit or home visits. Like first example is, I am writing to request a home visit for Miss X, who has been diagnosed with diabetic ketoacidosis. She requires further monitoring and education following her discharge today. Second example is, I am writing to request home visits for Miss X, who is recovering, or we can also write recuperating from mitral valve replacement surgery. She requires ongoing care and support from your facility. Next, fourth letter is in regard letter. I am writing in regard to Miss X, who has been diagnosed with urinary tract infection. She requires further evaluation and management following her discharge today. Last letter is transfer letter. I am sorry, this is fifth one, sixth one is also there. Example is I am writing to refer Mrs. X, who underwent left hemoarthroplasty for the management of fracture of the left neck of the femur. She is being transferred to your facility today for rehabilitative care. So well, one more point please kept in mind, like always use the in front of the body part. Next is example is I am writing to transfer Mr. X, who underwent VATS procedure for the management of stage 2 non-small cell cancer in the left lung. He requires further assessment and management. Last one is Discharge letter. First example is I am writing to refer Mr. X who underwent resection of the lung for the squamous cell carcinoma of the left lung. He requires palliative care following his discharge today. Next example is I am writing to refer Miss Sandra Peterson who is recovering from upper respiratory tract infection. She requires ongoing care and monitoring following her discharge today. So these are the example of all types of letters. It is a purpose paragraph. Okay. So friends, I hope you understand this video. So thank you for watching. If you have any query, do comment me. Please subscribe my channel. Thank you once again.